welcome to IBS in the nervous system, why your gut acts like a second brain. So for those of you who don't know me, my name is Coach Sam. I'm a licensed clinical social worker, and I also have an endorsement in infant mental health as an infant mental health specialist. I primarily work in the 5 boroughs of New York City. I also have a small private practice, and my goal regardless of any of the people that I work with, is to show how resilient and strong they are. So today we are going to learn about IBS and the nervous system and how they play a role in one another, how the gut and brain communicate, and lastly, how to manage your IBS through nervous system regulation. So before we get into all of that, I wanted to ask, have you ever felt butterflies in your stomach before a big event? Take a second to think to yourself, have you ever felt that feeling? And, what was going on for you during that time? Were you excited? Were you nervous? How were you feeling? The answer is usually yes. People have experienced butterflies in their stomach, even if they're excited, if they're nervous, if they're just getting into a new environment. And this is common because what if I told you that your gut actually has a mind of its own? And for those of you who are joining us that may suffer from different gut-like disorders, you may understand what I'm saying and may know how hard it is and may be able to trust your gut. So as you can see here, I'm going to trust my gut a little more, but for those of us with irritable bowel syndrome, we are not always able to trust our gut, right? Because this is a chronic disorder of gut-brain interaction characterized by abdominal pain, bloating, and altered bowel habits. So for those of you struggling with IBS, you can see that there's different subtypes down below, and you may have a particular subtype, or this may be the first time you're looking and hearing about subtypes. And though this disorder is not life-threatening, IBS significantly affects the quality of life and requires a multifaceted treatment approach that we will get into. So did you know that IBS is a prevalent disorder affecting 5 to 10% of the global population? Traditionally, this has been viewed as an intestinal motility disorder, and a motility disorder refers to a condition where the muscles and nerves in the digestive tract do not function properly, leading to abnormal movement of food and liquid waste through the gut. However, recent research highlights its complexity, emphasizing the intricate interactions among the brain, gut, and microbiome. So we'll get into a bit of this research article that I had found below. So risk factors for IBS include age, sex assigned at birth, family history, and mental health history. So according to this article, it says that IBS occurs more often in people under the age of 50. In the United States, IBS is more common among women. Estrogen therapy before or after menopause is also a risk factor for IBS, or if you are utilizing estrogen therapy. If you have a family history of IBS, this may be a risk factor. So, for example, genes may play a role, as many shared factors in a family's environment or a combination of genes and environment. So that old saying of nature versus nurture, irritable bowel syndrome can be a mixture of those. And lastly, if you have anxiety, depression, or other mental health issues, history of trauma, or different emotional or physical abuse, this may also be a risk factor for irritable bowel syndrome. So you might be wondering, if I have all these risk factors, what does this mean, and how is my gut connected to my brain? And to understand this, we're going to look at the ENS. This is a complex network of neurons embedded in the walls of the gastrointestinal tract. It is often called the second brain because it can function independently of the central nervous system and plays a crucial role in regulating digestion, gut motility, and communication with the brain. So to understand the ENS, we know that it's communicating with the brain via the vagus nerve. The ENS can independently control gut functions, as I mentioned, and there are a significant amount of neurotransmitters within the ENS. The ENS produces many of the same neurotransmitters as the brain, including serotonin. 95% of the body's supply is in the gut, as well as dopamine. So looking at this through the eyes of IBS and understanding that when the ENS has dysfunction, it can lead to hypersensitivity, altered motility, and increased pain perception in the gut. These are most likely contributing to symptoms of bloating, diarrhea, and constipation, which we often see in IBS. So it's interesting to see how all of these neurons are embedded in our gut and our GI tract, and how this plays a crucial role in how we regulate our digestion. Okay, so if you can see here, this breaks down really what I'm talking about in terms of the the ENS. So as I mentioned, IBS is a prevalent disorder that affects 5% to 10% of the global population, and through here we can see how it is not just a motility disorder. This is the complexity that is in IBS. So as you can see here, we have our brain immune loop, and these are the different risk factors that we talked about, so the different genetic compositions that may lead to a genetic risk factor for IBS, and as I mentioned, sex differences, so primarily females or those utilizing estrogen therapy, different exposure to sociocultural, early life adversity, developmental adversities, as well as diet, antibiotics, pathogens, and you can also see that adversity and stress, social support plays a role in our brain immune loop, as well as the different risk factors. So now that we understand how complicated this disorder is and how many things play a role, let's talk about treatment for IBS. So since IBS varies from person to person, treatment focuses on symptom management through a combination of lifestyle changes, dietary changes, and different medical approaches. So first, let's look at dietary changes. So most of you may have heard of the low FODMAP diet. This reduces fermentable carbs that often trigger bloating and discomfort. For some individuals suffering with IBS, this seems to do wonders for their digestive system. For example, also making fiber adjustments, so including different soluble fibers, oats, bananas, can often help with IBS-C and different constipation symptoms. Probiotics are often something that helps as well. Supporting a healthy gut microbiome may reduce symptoms. And lastly, avoiding triggers. So if you know, for example, that you may experience a severity of IBS symptoms after drinking coffee or drinking alcohol, you may want to avoid those things. Next, there's stress management and mind-gut therapies. So I wanted to include all of these that I had done research on, as I've never heard of gut-directed hypnotherapy as a therapist, but it just goes to show that all therapists don't know all different treatments. So this is something I haven't heard of, but it's proven to alleviate IBS symptoms by calming the gut-brain connection. There's also meditation and yoga by reducing stress, doing deep breathing exercises. This can reduce the amount of flare-ups. So this goes into the medications and different lifestyle modifications that you can use. I listed different medications here, including anti-diarrheal medications, different laxatives and fiber supplements, and some lifestyle modifications may help with just your overall health, as well as reducing your stress patterns. So regular exercise is found to improve gut mobility and reduce stress. Consistent sleep patterns. Poor sleep can often worsen symptoms. And lastly, hydration. So drinking enough water to support digestion. Okay. So you maybe have heard me mention the vagus nerve when we're looking at the gut microbiome. And this is the most important thing when we're looking to reduce stress, reduce trauma symptoms, and reduce just our overall sense of anxiety and different mental health disorders. So the vagus nerve is the main communication highway between your brain and gut, as I mentioned. It is the longest cranial nerve extending from the brainstem down to the digestive system, heart, and other organs. So I'm going to get into a few examples of how to calm your vagus nerve. And the first thing I want to focus on is progressive muscle relaxation. So progressive muscle relaxation is where you create tension and release the different muscle groups of your body at the same time. So if you can imagine, if you were working with a therapist or working with a different practitioner on how to get into progressive muscle relaxation, you would choose a quiet place and set aside about 15 to 20 minutes to do this exercise. You will squeeze the muscles from the feet to your head, including all the different areas. So for example, using my hands, I'm going to show you here that we're going to squeeze our fist, and it says to hold it for 5 to 10 seconds. So then you're going to relax for 10 to 20 seconds before moving on to the next group. And you should be able to focus on the different muscles, and that's here, my video is blocking it, that you should not tense your muscles so hard. So you shouldn't feel sore from this exercise. Instead, you are retraining your vagus nerve to understand when it is tense and when it is not. So that hopefully, if you are experiencing IBS symptoms of pain and tension, your gut will be able to. The next activity we're going to do is something that you can practice at home if you want to save this video and replay it. This is called the EMDR light stream. So we're going to focus on an area of your body where you feel any tension, tightness, pressure, or numbness. So this can be, if we're focusing on our IBS symptoms, it can be our stomach, it can be any part of our body that we're experiencing tension, tightness, pain, pressure, or numbness. So if you can say, if you're hearing me say that and say, hey, Coach Sam, there's multiple areas of my body where I feel that. I want you to focus on the one that feels the most painful and needs attention and support at this time. So next I would ask the questions that are listed here. If that area had a shape, what shape would it be? If that area had a color, what color would it be? And next I would ask you, what is your favorite color of light you associate with healing and warmth? So I want you to think of those three things as we go into this exercise. So it'd be helpful if you're in a comfortable position, your feet firmly planted on the floor, you can feel free to close your eyes, and I want you to breathe slowly and deeply, and allow that column of colored light to come gently through the top of your head and direct itself at the place in your body where you feel that tension, tightness, pain, pressure, or blockage. Allow the light to go directly to that area, completely cover it, soften it, dissolving as much as possible without forcing it as more and more light flows in. Allow the light to flow throughout your body, softening and warming as it flows down through your head, face, neck, across both shoulders, and down your arms, flowing gently out the tips of your fingers. Allow the light to flow down through the trunk of your body, down through your chest, back, stomach, abdomen, pelvis, and hips. Allow the light to flow down through your legs and down and out the soles of your feet. And when you're ready and when you feel comfortable enough, take a slow, deep breath and tell yourselves the words that you most need to hear. Slowly count to 3 and gently open your eyes. So remember to take care of yourself, ask for help when you need it, and treat yourself with kindness. As mental illness recovery is possible, IBS symptom management is possible. So thank you so much for attending. If you have more questions related to just general mental health, IBS symptoms, and treatment for different mental health disorders, please feel free to contact me at samantha.feldman@waliba.io. Thank you so much and have a great rest.